Hi students, I welcome you all to Obstetrics and Gynecology with Mackler. So in this module, we are going to start with the next important section in contraception, and that is all about the intrauterine contraceptive devices, which is also called as the intrauterine devices IUD. Right? So this module is going to be all about the basics of intrauterine contraceptive devices, the classification of the intrauterine contraceptive devices, and we are also going to deal with class 1 and class 2 of the IUDs as well, right? Fine. So to begin with, what is an intrauterine contraceptive device? So basically it is a device which has the action of contraception, and this device is introduced inside the uterine cavity. So it is basically a device which has the contraceptive effect and it is inserted inside the uterine cavity. So it can be called as intrauterine contraceptive device as well, right? So it is called as IUD, intrauterine contraceptive device. Okay, so to discuss about the intrauterine contraceptive device, this is one among the effective methods of contraception, right? It is an effective method of contraception, and also the most important point to note here is it is a reversible contraception, right? It is a reversible contraceptive method, and then it is a long acting contraceptive. So what do you mean by long acting contraceptive? By reversible means I understood that if the intending couple is going to just abstain from this intrauterine contraceptive device, they can reverse their fertility very soon. But what do you mean by long-term contraceptive? Which means that, see, there are certain contraception for which we have to renew it every month, or say, let's say for example, we have a contraceptive options available like the depot medroxyprogesterone acetate injection, which has to be taken monthly, right? And similarly, when compared to the barrier contraception, we discuss about the male-female condom diaphragm. Well, during every such act of coitus, the intending couple has to wear it. But with respect to this intrauterine contraceptive device, this can be used as a method of contraception for a longer period of time, unlike the other methods of contraception. To be in even more simpler words, this need not be renewed every single month, or this need not be renewed every shorter period of time, which means that this contraception can be used for a longer period of time, even for years, right? So that we will be discussing in detail once we start discussing every salient points. So it is an effective contraception and it is a reversible contraception. Once the intending couple is going to abstain from this IUCD, they are going to retain the fertility very soon. And it is a long acting contraceptive, which means that it need not be renewed over every shorter period of time. So this can be used for a longer period of time, unlike the other contraceptive methods. And the most important point here is it does not interfere with the act of coitus. Unlike the barrier contraceptive, the couple might have some sort of discomfort, irritation, erosions, anything can happen, and that might interfere with the coitus as well. But since this is a device which is inserted inside the uterine cavity, it does not cause any sort of discomfort, or it does not interfere with the act of coitus. Clear? Yes. So basically it is a device which is fitted inside the uterine cavity. Yes? Okay. So now moving back to the discovery of the IUCD. See, it is not very important to learn about the discovery, the year, who invented it. That is not important for us. But then it is also important to know that which came first and which was then later replaced by what. Right? So the first IUCD was introduced by 1970, right? So early in the 1970, the first IUCD was invented, and that IUCD was made up of polyethylene, right? It was made of polyethylene, and later the invention came to polyethylene, which was impregnated with barium sulfate IUCD. See, IUCD was made entirely of polyethylene primarily, that by 1970, but later then the IUCD, along with being made by the polyethylene material, it was also impregnated with barium sulfate. Now you may have a doubt that why it is impregnated with barium sulfate. Does it have any contraceptive effect? No. See, barium sulfate doesn't have any contraceptive effect. But then, as a clinician, once you are going to put this device inside the uterine cavity, you need to make sure that this device is fitted properly inside the uterine cavity and it is not expelled outside. So in order to make sure whether the device is inside the uterine cavity, as a clinician you have to do some investigations like imaging techniques, X-ray and ultrasound. So in X-ray and ultrasound, if you need to visualize this intrauterine contraceptive device, it has to be radio opaque. Only if it is radio opaque, it will be easy for you to identify through the imaging techniques. So for that purpose, this polyethylene made intrauterine contraceptive device was impregnated with this barium sulfate, which makes the IUCD as radio opaque in nature. So therefore, in X-ray and ultrasound imaging, this IUCD can be identified, and this also helps us to know whether the IUCD is inside the uterine cavity or it is expelled outside the uterine cavity. Is that clear? Yes. So later the invention gone, like the medicated intrauterine contraceptive devices came into play, where initially the copper containing intrauterine contraceptive device was invented, and later even hormonal intrauterine contraceptive devices like the progesterone containing intrauterine contraceptive device were invented. See how the invention went off. Initially only a simple intrauterine contraceptive device which was made up of polyethylene was invented. Later that device was impregnated with barium sulfate, which facilitated the visualization of this IUCD inside the uterine cavity through the imaging techniques. And later medicated intrauterine contraceptive devices such as the hormone containing IUCD, the copper containing intrauterine contraceptive device was invented, right? So this is how the invention is going on in this modern world, right? Okay. So now we move on to the classification of intrauterine contraceptive devices. So basically we have three classes, which is the first generation intrauterine contraceptive device, the second generation intrauterine contraceptive device, and the third generation intrauterine contraceptive devices. Clear? So we have three generations, first, second and third. So the first generation is nothing but the IUCD, which was invented earlier, which is called as Lippes loop. There are many first generation IUCDs, but then you need not remember everything in detail. You just need to know the term, that's all. It has not been asked very frequently in any examination. So it is very okay for you to just learn the term itself, right? So Lippes loop is the first generation IUD. The second generation is the copper containing intrauterine contraceptive devices. So what are the copper containing intrauterine contraceptive devices? So those are copper T380A, as I have written here, copper T380A and multi-load 375. So copper T380A and multi-load 375, or these two are the copper containing intrauterine contraceptive devices which belong to the second generation intrauterine device. And the third generation is where the hormonal IUD is coming into play. So hormonal IUD, like the progesterone containing intrauterine contraceptive device, is the third generation IUDs. So I have written here LNG IUD. So what do you mean by LNG IUD? LNG is nothing but levonorgestrel, which is a form of progesterone. So this levonorgestrel progesterone is in this IUD. So since this IUD is containing the hormone progesterone, it is a hormonal contraceptive and it is popularly known by the name Mirena. Is that clear? Yes. So the first generation is Lippes loop, second generation is copper containing IUD, third generation is hormonal progesterone containing IUD. Is that clear for you? Yes. So now we are moving to the first generation intrauterine contraceptive device, that is Lippes loop. So as you can see in this image, this is the image of Lippes loop. So what is Lippes loop? So Lippes loop is also an intrauterine contraceptive device, right? It is made up of polyethylene, similar to one which was invented first, right? So polyethylene, and it is a non-medicated intrauterine device, which means that it is not containing any hormone, it is not containing any copper, any hormone is not present. It is just a device which is made up of polyethylene. And as you can see here, it is very small and it is flexible and it is an inert device. So small, flexible and inert device. and this is inserted inside the uterine cavity. So it is an intrauterine contraceptive devices. But also it is important for you to know that it is available in 4 different sizes, which is A, B, C and D. Among this A, B, C and D, D is the largest Lippes loop, right? So D, as I have highlighted here, D is the largest size intrauterine contraceptive device belonging to first generation, that is Lippes loop, right? Okay, so now you may have guessed that why it is called as Lippes loop, because it looks like a loop, right? It looks like a loop. The shape is like a loop. So therefore, it is called as Lippes loop. Now, you may have a doubt that you told me that this is just a device which is very small, flexible and an invert device which is not containing any hormones or any copper. No, it is non-medicated, right? So once it is going to be non-medicated, how it is going to have some contraceptive effect? It is just a simple device which is put inside the uterine cavity. What is going to happen? You may have this doubt. So the main mechanism of action of this Lippes loop is that once it is inserted inside the uterine cavity, this Lippes loop is going to induce a foreign body reaction in the uterine endometrium, which means it is going to initiate an inflammatory reaction in the uterine endometrium. So once there is inflammation, there is aggregation of macrophages. These macrophages are going to exhibit phagocytic activity towards the sperm, right? So whenever the intending couple is going to have the act of coitus, once the sperm is released, right, this inflammatory reaction which is happening in the endometrium, it is going to exhibit aggregation of macrophages. These macrophages will exhibit phagocytic activity and it is going to kill the sperms. That is one such action. The second is that since it is going to exhibit an inflammatory reaction in the uterine endometrium, it is going to make the uterine endometrium out of phase for the implantation. So therefore, it is preventing the implantation and it is also inhibiting the fertilization as well. Is that clear for you? So it prevents the implantation and it inhibits the fertilization as well. Clear? Yes. Now, you may have a doubt that you told me that it is an inflammatory reaction which is happening in the uterine endometrium. Now, whether it is a sterile inflammatory reaction or whether it is a asterile inflammatory reaction. So, it is a sterile inflammatory reaction that is happening in the uterine endometrium, because the method through which we are going to insert this Lippes loop inside the uterus is going to be a very sterile technique, where the method of insertion is popularly called as push technique. Basically, you are going to push this Lippes loop inside the uterine cavity, right? And it is going to be a sterile procedure. So therefore, the inflammation which is happening here is a sterile inflammatory reaction, right? It is a sterile inflammatory reaction. Fine. Now, what was the reason that these intrauterine contraceptive devices is later replaced by the second and the third intrauterine contraceptive device? It is because of the fact that all these non-medicated intrauterine contraceptive devices which were belonging to the first generation, including the Lippes loop, they lead to higher pregnancy rate of about 3%. So among the women who used this Lippes loop, about 3% of women ended up in pregnancy. So when compared to the entire contraceptive devices, first, second and third, the first generation IUD has higher pregnancy rate up to 3 to 5%. And it also had higher rate of expulsion, right? It had higher rate of expulsion and higher rate of pregnancy. So because of that reason, it was later replaced by the medicated intrauterine contraceptive devices, including the hormonal and the copper containing IUD. Is that clear? So this is all about the Lippes loop. So if it is clear for you, we can move now to the next session. So now we are moving towards the second generation IUD. So as we know, second generation IUD is all about copper containing intrauterine IUD. You may have a doubt that whether second is copper or whether third generation is copper. I have a small hint for you. The third letter is C. So C belongs to copper, right? So second generation IUD is copper containing IUD. Okay, so under copper containing intrauterine contraceptive devices, we have two devices available with us. So one is the copper T380A, which is also called as Paragard, and the second one is the multi-load 375. So copper T380A, which is also called as Paragard, and multi-load 375 are both the copper containing intrauterine contraceptive devices. And the intrauterine contraceptive devices which are included in the National Family Planning Program are these second generation copper containing intrauterine contraceptive devices, that is the copper T380A Paragard and the multi-load 375, right? So this is a very important question for you. Fine. Now what is the mechanism of action of this copper intrauterine device? So similar to the Lippes loop, this copper intrauterine device, what is going to do is that this intrauterine device which is impregnated with copper, this device once inserted inside the uterine cavity, it is going to release copper every single day. So with a particular amount, this device is going to release copper to a particular amount to an extent every single day. So once this copper is released, it is going to induce a sterile inflammatory foreign body reaction in the uterine endometrium. As well as due to this inflammatory reaction, because of macrophagic phagocytic activity, it is going to have a spermicidal action towards the sperm, and therefore it is going to prevent the act of fertilization. And since this inflammatory reaction is going to make the endometrium, the uterine endometrium, out of phase for implantation, it is going to inhibit the implantation as well. So it prevents the fertilization and it inhibits the implantation as well. Clear? So the mechanism of action between this Lippes loop and copper T is the same. In copper T, copper is getting released, which is initiating inflammatory reaction and prevents the fertilization and inhibits the implantation. In Lippes loop, this device is going to cause sterile inflammatory reaction, and which is going to later on lead to prevents the fertilization and inhibits the implantation as well, right? Fine. And the most important point with respect to copper T is that copper T can be used as an emergency contraceptive agent. So emergency contraceptive agent is that particular agent which an intending couple is going to use after having unprotected intercourse, right? So immediately after having unprotected intercourse, if they don't want to conceive, they have to take this emergency contraception within 72 hours, right? 48 to 72 hours, they have to take some emergency contraception. So one among this emergency contraceptive agent is this copper T. Clear? Yes. So now moving on to the details of copper T. So the first one is copper T380A. So as the name signifies, as you can see in this image, copper T is a T-shaped device. As you can see here, it is a T-shaped device, right? And it is a second generation IUD. We know that copper containing intrauterine devices are second generation IUDs. As you can see in this image, coppers are present over the stems and the arms. So this portion is the stem and this portion is the arm portion. So both in the arms as well as in the stem of the copper T, copper is present. And over the distal portion of the stem, you can see a ball is being present. So the surface area of this ball is around 3 mm square. The major use of this ball in this copper T is to prevent the uterine perforation. So once this copper T is put inside the uterine cavity, this ball is going to act as a grip and it is going to prevent the uterine perforation, right? Yes. And the total surface area of copper present in copper T is around 380 mm square, right? So 380 mm square of copper is present in this copper T. Now you may have a doubt that why it is called as copper T380A. So it is called as copper T because it is a copper containing intrauterine device and it is T-shaped. So it is copper T. 380A means 380 is the surface area of copper present in this entire copper T. And A means the arms, the horizontal arms, as you can see here. A stands for this arms. So copper T380A is defined as such, right? Okay, so the total surface area of copper is around 380 mm square. And this copper T, once inserted inside the uterine cavity, it is going to release copper every single day. And it is going to release about 50 microgram of copper per day. So every day 50 microgram of copper is released from this copper T once it is inserted inside the uterine cavity. Clear? Yes. Now earlier, when starting with this module, I told you that it is a longer acting contraceptive choice, right? Why it is longer acting is because the lifespan of this copper T380A is around 10 years. So for 10 years, you need not worry about anything. So once it is inserted inside the uterine cavity, it proves to be efficacious for the next 10 years, up to a maximum of about 12 years. So 10 is the minimum and 12 is the maximum years. So 10 to 12 years, this copper T is actually effective, right? Fine. So once this copper T is inserted, it is doing its work properly. But then what are the complications or side effects which can be anticipated from this copper T? The most common complication with respect to insertion of this copper T is bleeding per vaginum, right? So bleeding is the most common complication, and apart from that, immediately after the insertion of the copper T inside the uterine cavity, we can expect some ascending of infection along with the copper T if not held in a sterile precaution, right? This might lead to some inflammatory disease. What inflammatory disease? Pelvic inflammatory disease can happen in such females, even though the risk is somewhat deteriorated. Therefore, pelvic inflammatory disease can also happen with respect to this copper T380A insertion. So the complications which can be anticipated are bleeding and pelvic inflammatory disease. So this copper T is going to prevent all the type of pregnancy, including the normal pregnancy, the ectopic pregnancy, and all the pregnancy is prevented by this copper T. But in case if failure is going to occur, if failure of this contraceptive device is going to occur, then the chances of ectopic pregnancy is going to be increased, right? As you can see here, see, copper T is used as a contraceptive agent. So therefore, it is going to prevent the normal pregnancy as well as the ectopic pregnancy. But if in case this copper T is going to fail, then the chances of ectopic pregnancy, the relative risk is actually going to increase. So absolute risk of ectopic pregnancy with respect to copper T is decreased, but the relative risk of ectopic pregnancy with respect to copper T is increased. Clear? Yes. And as I have told you earlier, copper T380A can also be used as an emergency contraception, right? So this is all about copper T380A which you need to learn. Now, moving to multi-load 375. So multi-load 375 also comes under the second generation copper containing intrauterine device. So unlike the copper T380A, the multi-load 375 is not T-shaped device. It is not a T-shaped device. As you can see here, there are two arms. This device is going to have two arms, and both the arms are very flexible. So flexible arms are present in multi-load 375, but T-shaped, that is horizontal arms, are present in copper T, right? So multi-load 375 has a very flexible arms, and these flexible arms are provided with spurs. As you can see here, these are the spurs which are present in this flexible arms, and the major purpose of this spurs is to prevent the expulsion of the device. So once it is put inside the uterine cavity, you have to ensure that it is fitted properly inside the uterine cavity, and these spurs which are present in the flexible arms of this multi-load 375, it is going to prevent the expulsion of this multi-load 375 device, right? And unlike copper T380A, where copper is present both in the horizontal arm and in the stem, in multi-load 375, copper is present only in the stem. So only in the stem portion copper is present. Copper is not present in the arms, right? And unlike the copper T380A, multi-load 375, the total surface area of copper in the stem of the device is around 375 mm square. So only 5 mm square difference is between this copper T380A and multi-load 375, right? Okay. And unlike the copper T380A, the lifespan with multi-load 375 is decreased, which is about 5 years. But then still it is a longer acting contraception when compared to the other methods of contraception available to us. So copper T, the maximum effect can be from 10 to 12 years. With multi-load 375, the maximum lifespan of this device can be up to 5 years. And the copper in the copper T has permissible action, and it is going to induce inflammatory reaction in the uterine endometrium. It is going to make the uterine endometrium out of phase for implantation. So therefore, multi-load 375 is going to prevent the pregnancy, right? So the absolute risk of ectopic pregnancy is actually decreased with multi-load 375, right? So both this copper T378 and the multi-load 375, sorry, let me correct it, the copper T380A and copper T380A and multi-load 375 are both the copper containing intrauterine devices, right? So one's lifespan is around 10 to 12 years and multi-load 375, the lifespan is around 5 years, right? So the copper is going to induce an inflammatory reaction in the uterine endometrium. It makes the uterine endometrium out of phase for implantation. It prevents the fertilization and inhibits the implantation, right? Fine. So this is an ideal contraceptive agent. So therefore it is an effective contraception as we have discussed earlier. Fine. So now we have come to the most important ending session of this particular module. You may have a doubt that I haven't discussed about how you are going to insert this copper T and what are the other such important things such as the complications which can be expected and when is the correct period to insert this copper T. All these things will be discussed in the next module. With respect to this particular module, you have to learn the basics of each and every contraceptive, right? The most important thing which I forgot to tell you here is that it is provided with a thread. So both the copper T 380A and multi-load 375 both is provided with a thread. As you can see here in copper T 380A it is provided with a polyethylene monofilament thread, and in multi-load 375 also we have a nylon thread. The importance of this thread is that it is going to lie in the vagina. So this device is going to fit inside the uterine cavity and the distal portion, that is the thread portion, is going to lie in the vagina, where both the doctor, the clinician as well as the patient can actually palpate this thread. So whenever the intending couple is going to decide to remove this intrauterine contraceptive device, these patients can be put on the table and with the help of this thread as a measure, this intrauterine contraceptive device can be removed with the help of this thread in place, which acts as a fulcrum. Right? Okay. Now moving to the important one-liners with respect to this intrauterine contraceptive device which we have discussed until now. Fine. So what is the most common side effect of copper intrauterine contraceptive device insertion? So as we have discussed earlier, the most common side effect is nothing but the bleeding. Right. And the most common cause for removal of the intrauterine contraceptive device, it is pain and discomfort. The best contraceptive of choice for HIV positive patients is what? So the best contraceptive of choice for HIV positive patients is copper T. Copper containing intrauterine devices. And the best contraceptive method to prevent the sexual transmission of HIV is barrier methods, right? So let me discuss about this now. See, the best contraceptive of choice for HIV positive patient is copper T. Why? Because is that, as we have discussed earlier, this is one of the most effective contraceptive method, and at the same time it is a longer acting contraceptive device. At the same time, it doesn't have any side effect with respect to hormonal intrauterine contraceptive device as well, right? So the hormonal side effect are avoided. So it is just a copper containing intrauterine contraceptive device which is inserted inside the uterine cavity. So the side effect which can be expected to a maximum is all about the bleeding, pain, discomfort, and sometimes there could be infections which could lead to pelvic inflammatory disease. So apart from these complications, there are no other complications which are related to hormonal containing intrauterine contraceptive device. But because of that hormone, there could be further complications which can be expected in this patient. So therefore, the best contraceptive of choice for HIV positive patient is copper containing intrauterine contraceptive devices. Is that clear? Yes. But best contraceptive method to prevent the sexual transmission of HIV is what? Please remember, always in order to prevent transmission of sexually transmitted diseases, a barrier contraceptive has to be used, because only a barrier contraceptive is going to prevent the interaction of the semen and the vaginal secretions. If the vaginal secretions are going to be embedded with the infectious agent, it is going to further ascend up and it is going to lead to sexually transmitted infections as well. So always with respect to prevention of transmission, the contraceptive of choice is going to be the barrier contraception. And similarly, the best contraceptive method to prevent the sexual transmission of HIV in HIV positive patients is also barrier contraceptive, right? Fine. And another important point here is that since the copper containing intrauterine contraceptive device does not have any side effects or complications which are related to hormonal IUCD, because hormonal IUCD is one which contains hormone in it. For example, the third generation IUD, that is progesterone containing IUD, is a hormonal IUD. So if you are going to use a hormonal IUD, the patient will also have the complications and risk with respect to those hormones, right? So once the hormone is going to release, the hormonal complications can also be anticipated in such patients who are using hormonal IUD. But with copper IUD, there is no hormonal complications are present because copper is not a hormone, right? So hormonal contraceptive complications are avoided with copper IUD. So therefore, copper IUD can also be used with great safety in these patients such as HIV positive patients, patients with comorbidities such as diabetes mellitus. In such patients also, since the other hormonal complications can be avoided, copper T can be used in them. And apart from that, all these stable heart disease patients can also use this copper containing intrauterine contraceptive devices as the contraceptive agent, right? So this is all about the first and the second generation intrauterine contraceptive devices which we have discussed in this module. In the next subsequent module, we will be dealing about what is the particular time or what is the best time for insertion of intrauterine devices, what are the complications which can be anticipated, right? And every important thing will be discussed in the next module. And following that module, we will be discussing about the third generation intrauterine contraceptive device, that is progesterone containing contraceptive device Mirena, right? Unless, please keep studying, right? Until please keep studying. And if you have any doubt, please write to me in the Mackler Gmail handle, and please subscribe